Welcome back to Houston Life. Now, if you are constantly in pain, it might be a struggle to focus on everyday activities. Well, one doctor can treat the pain, and he even offers a procedure where he can actually talk with his patients while performing surgery. Pretty incredible. Dr. Meyer Kanja with KSF Orthopedic Center is here to tell us all about it. And later in the show, one of your patients will also be here to share her story.
That is correct, yep.
So welcome to the show.
Thank you. Thank you for having me.
Now, your specialty, you are a board-certified anesthesiologist. You also specialize in pain management.
That's correct,
So
yes.
chronic pain, I mean, this is not just, stressful on our bodies physically, it's also emotionally stressful, right?
Yeah. Chronic pain can affect the patient home life, social, life,
Yeah.
activity level.
At work?
At work. It could affect pretty much their entire lives and their family members as well.
So when people come to see you then, they can be suffering anything from back pain?
From migraines down to foot pain, mostly back pain, mostly neck pain, but pretty much a variety of different body parts, yeah.
And for a lot of people who are going to see a doctor regularly, it seems like medication is what people are often sent to, right? But your approach is a little bit different.
Exactly. So medications are just one aspect of treating pain. There's physical activity, there's physical therapy, there's different procedures, there's surgery, but medications are being focused on right now, especially opioids. Over time, opioids don't really work as well, and then they do have a lot of side effects as well. So we're trying to capture other modes of treatment besides just pain medication.
And one of the things that we mentioned is the surgical side to this. I mean,
that's correct.
So you have a minimally invasive procedure. Exactly what is it? How does it work?
So it's a spinal cord stimulator. So the way it works is it's a two-part procedure. The first part is a trial, just completely temporary. We put in 2 leads with 2 needles, okay? And there's no incisions with the trial temporary portion of it, okay? So we put in these electrical leads, okay?
And that's what we're seeing right now.
That's what we're seeing. Yeah. The patient is awake for this, okay? And so once we turn it on to the stimulation setting, we ask the patient where they're feeling it and where they're getting their pain coverage, okay? Once they're getting good pain coverage, we secure it all down, okay? And they go home for a week. During that week, we evaluate their activity level, their medication use, how happy they are, overall their pain level, okay? And if they're very, very happy during that week period, we can go ahead and put in the real implant.
Oh, wow, so it's sort of like a trial period.
Yeah, so there is a trial period, exactly, that the patient will know whether they want to have this done or not. Now, 95% of my patients go ahead and get the real thing. Now, the real thing is also minimally invasive. There's 2 tiny incisions, okay? We're not cutting bone, we're not cutting muscle. We are putting in these 2 leads permanently, and then we are putting in a battery, okay?
That is so cool.
Yeah.
So those little electrical pulses then are essentially going in and eliminating the pain.
It pretty much eliminates, the way it works is it stops the pain nerve from going into the spinal cord.
Now, you also brought a video of a recent surgery that you did with a patient, and I want to just pause for a moment and show this video because you can actually hear that you're having a conversation with the patient. Let's take a look.
Tell us where your pain is.
It is in my lower back, L4, L5, L5S1.
Mm-hmm. And does it radiate down your legs?
Both legs, and it will do weird things from time to time.
All right, well, we'll be doing this procedure where we'll be putting the leads into your back, and once we're covering your painful areas, we'll get you on into recovery, okay? All right.
Stronger on one.
Your butt even.
Okay. Is it getting up into your back?
No.
Getting up into your hips?
No.
Okay. How high in the legs is it getting?
And then how far down do you feel it?
I feel it down.
You doing okay? Doing great. So, Ms. McPherson, where do you feel this?
I don't feel anything.
Okay. How did it feel?
Great. Absolutely great.
Wonderful.
I mean, that's incredible that they can actually provide immediate feedback to let you know where the pain is.
Exactly. So when the pain is not being covered at that time, we will just adjust the leads to make sure it's covering the painful areas.
That is so cool. Well, as we mentioned in the show, we actually have this patient, Linda McPherson, with us today. Linda, do you want to come on out? There she is, looking all fancy. I thought you were going to wear your hospital gown. How are you? Want to have a seat next to the doctor? So tell us, Linda, what were some of your symptoms before going in to see Dr.
Very bad pain.
Just back pain.
Pain from a lot of places, but mostly back pain. And Dr. Conjure did injections, and we did ablations. And then finally he said, I think I know something that might help.
So surgery then seemed like it was the appropriate option because nothing else had worked?
She has also had major back surgeries in the past. She's also had, tried multiple different physical therapies, multiple different medications. She has gone through the whole ringer, okay? So this is not the major back surgery. This is just the spinal cord stimulator. But she's already tried the big back surgery.
And like, how do you feel today? Because it seems like you move around fine.
It's really a miracle. And I'm thankful for Dr. Conjure, and I'm thankful to those Boston Scientific folks who made this little instrument. I carry a remote with me all the time, which is that.
Oh, that's the remote.
It can be moved up and down to adjust to your pain.
So you can increase then the stimulus, or the stimuli, rather, if you're feeling a little more pain, or decrease it as needed. So now do you feel like you can focus on other things in your life?
I do, and it's a pleasant feeling. It's tingling. I tingle all the time. So it's remarkable from what I was doing.
So a little tingle is much better than being in
Absolutely.
chronic pain.
Absolutely.
Well, that is fantastic. It seems like, in many cases, surgery would be the last resort. In this case, as you mentioned, though, with Linda, this was just one of many surgeries that, you'd had many other back surgeries that hadn't been successful.
No, 15 years of it.
15 years.
So.
All right. Well, I'm going to give you this little remote.
Sure.
I don't want to accidentally dial you up or down too much. Linda and Dr. Conjure, thank you so much for stopping by.
So welcome.
Thank you so much for having us.
Of course. And if you guys would like more information about KSF Orthopedics, you can visit their website, ksfortho.com. You can also call them if you use a telephone, 281-440-6960. And thanks again to you both. Coming up next, Eyes on Houston tells us why Michael Bolton was right.